Key policymakers, lawmakers, health leaders, and development partners have critically examined how to improve domestic resource mobilization. At the summit on immunization financing champions, experts focused on securing sustainable funding for vaccines and primary health care across Nigeria. The summit in Abuja opened up discussions on the urgent need to strengthen the basic healthcare provisions fund, ensure timely releases, and advance constitutional and National Health Act amendments that will generate stable, predictable financing for primary health care. Experts also highlighted physical gaps emerging as donor support declines, urging states to ring-fence health budget and adopt innovative funding models. The summit also recognized outstanding immunization financing champions from the National Assembly and several states for their leadership in improving vaccine access and strengthening health systems.
Consolidated fund. If you break it down into the lowest level, you will see that it's just about 300,000 that a primary health facility is receiving in a month. That is grossly inadequate. So the state government also have to do their matching fund much more than what the federal government is putting in place.
So immunization champions that have been convened here today, I think have a major role, especially within the legislature, to promulgate laws, to restructure the way the financing is done so that the quantum of the resources is increased, but the timeliness of release is also improved, because it's one thing to have the resources. So the Senate and in fact the House are working to increase basic healthcare provision fund from 1% to 2%.
So the next one we're looking at is looking at a constitutional amendment, which is an ambitious one for us, but that covers everything. We will have 1% of the federation account dedicated to health. So that when we're talking of immunization, we're talking of primary health care, we're talking of domestic financing for vaccines, we're talking of everything that pertains to the health of Nigerians. We don't want to be thinking too much.
With the population of Nigeria and then the number of births we're having per year, if we sleep on vaccines, if we sleep on our primary health care, that means the number of maternal mortality rate will continue to soar high, and then of course we'll continue to be on the news for the wrong reason.